too. So those are the main things we're going to be looking for in our squats, making sure that we've got those things right and we're performing them correctly, and coming up with some common fault and cues to correct those things. I've also got Dave here. So Dave, as you know, is a spinal and neurosurgeon. He's also a qualified Olympic lifting coach, as I am, and we're both level 1 trainers at CrossFit. Dave has a massive amount of knowledge in terms of functional movement, in terms of his clinical background, obviously, so he'll be giving a bit of a talk in a second about how important squatting is to functional movement. And then for the rest of the workshop today, we're going to be looking at basic squats. Second, now I'm going to hand it over to Dave, and he's going to talk to you about squatting and functional movements.
Morning guys, I think I know all of you. Kate, Drew, Brian, Lisa and Courtney. Yes, thanks for the kind intro. I've been doing CrossFit for around a year, and it's had a pretty profound effect on the way I practice my neurosurgery. Because up until I did CrossFit, I just saw a lot of back pain patients, and if I couldn't fix them with surgery, there was really not a heck of a lot of other options for patients. And a lot of my patients would come and say, look, I can't do exercise because I've got knee pain, or I can't do this sort of rehab because I've got back pain. And it was a bit of a professional epiphany for me that the reason why people have these pains is because they are not squatting. And even amongst the medical profession, I regularly hear the top of our food chain in terms of physical rehabilitation experts and physicians say, no, you mustn't squat. And this is absolutely ridiculous. The squat is a quintessential movement for developing, number one, fitness, but also a healthy spine. Because if you think about all athletic endeavours, whether it be the CrossFit Games, Richard Froning, or whether it's hanging out your laundry or picking up the groceries, all athletic endeavours, no matter what sort of scale, require powerful hip extension. The more powerful you are at hip extension, the better athlete you are. There is not one sport that doesn't require powerful hip extension. With powerful hip extension, it goes synergistically, or it goes hand in hand with a powerful core. Because you got to ask yourself, what is core? What are core muscles, or what are core stabilizers? Core stabilizers are any muscle, whether it's your diaphragm, your pelvic floor, your six-pack, your obliques, your erector spinae. They all contribute to stabilizing the spine. Now, if you have powerful hip extension, which we're going to develop through the squat, you will also have a powerful core. Because all of the movement, this is like your bum muscles and your hammies and the quads are like the engine under the bonnet of your car. Your spine is merely a transmission. It's a rigid transmission of force. So just like the engine provides the power, your spine is like the axle or the drive shaft in your car. And if you had a very weak, floppy drive shaft in your car, no matter if you had a V8 or a turbo or whatever, you wouldn't be able to transfer that power to the wheels on the ground. And so by having powerful hip extension, via practicing the squat really effectively, you will also develop a very powerful spine. And learning that through doing CrossFit, would you believe, has altered the way I practice surgery. And you may or may not know, but we train patients here to do the squat essentially. We're teaching them how to squat, or we're teaching them how to move, and I refer to that as the sport of movement, and life is the sport of movement. So I normally give this little discussion to patients. Now, I haven't really given it to athletes before, but when athletes, healthy people, engage in CrossFit, they become super fit. When sick patients who come in and see me, decrepit and disabled and on drugs and unable to work, we turn them back into domestic athletes or normal human beings, from being disabled to being healthy and being able to go back to work. But when you guys do it, because you're already working, you just become superhuman beings. You transform into mega athletes. And that's the secret to why CrossFit works, because it's, well, let's ask you, what is CrossFit, right? How would you define CrossFit?
Well, it's a multidisciplinary sports type function. It involves a variety of different things that use both your strength and your endurance and your stamina. The idea is to cover all facets of fitness and group them all together. That's the way I interpret it.
And the 10 domains that we talk about there on the board. Any other definition? Any other key element in that description that Brian left out?
I think the objective is improving functional movement.
Functional movements, exactly. So that's a key word. Functional movements. And Courtney, are you fairly new to CrossFit?
I've been here a few months.
Longer than me. Okay, no. So, side question? Lisa, anything to add there in terms of the definition of CrossFit? So it's constantly varied, as Brian mentioned, constantly varied functional movements at high intensity. And I'll go through the work that through. And what is the definition of fitness, Kate?
Well, I guess it's different for everybody, but I don't know, from my personal experience, I would say fitness is something that allows you to be a normal functioning human being or utilising your body to its full capacity.
Yep. So is fitness important?
Absolutely.
Fitness is health, okay? And people say, well, what about mental health? I can guarantee you that, and there are studies that show that the fitter you are, the better your mental health. And psychiatrists are actually starting to use physical fitness and training as opposed to drugs for mental health now. So fitness is health, and it's such an important topic, but it's very nebulous. Your description of fitness might be different to Lisa's and Courtney's and Brian's. But if something that is so important doesn't have a definition, it's very hard to develop a program that can enhance fitness. So before you do anything, like think about your work, you have to have a definition of things to be able to optimise their efficiency. And that's the other thing that CrossFit has done, is it's defined fitness. And the way that we define fitness is functional capacity. Functional capacity across broad time and modal domains. Okay, now, what does functional capacity mean? We can define that even further into force times distance divided by time. That's power, or average power. Now, if a triathlete, if Australia's best triathlete came in and said, oh, well, I'm fitter than you, you could say, well, what's your functional capacity? And he probably wouldn't know. So he may be a better swimmer, runner, and cyclist than you. But if you can say, my functional capacity is this across broad time modal domains, by definition, you have a mathematically higher level of fitness than him. And every workout we do, whether it's Murph, Fran, Cindy, we can actually calculate a number. Okay. Now, the more workouts we do across more modal domains, across broad time, short workouts, fast workouts, we can actually map fitness. So he might say, I'm a faster runner than you, but he can't say that he's fitter than you. And we already just mentioned how important fitness is, because fitness equals health. And there's not too many things that are more important than health. So CrossFit is actually very mathematical and very scientific, which is one of those things that really drew me in, because I consider myself a scientist in terms of my career. And that's what's so much more appealing about CrossFit than, say, just going to your local PT and your local jets. One more question. What is a functional movement? That's the other important definition, because you mentioned functional movements, and we know the definition of CrossFit is a high-intensity functional movement. What is a functional movement?
And movements that replicate activities that generally appear through everyday life. I don't know if that would be my understanding of movement.
Yep. So turning on a tap. Yep. Patting the dog. Walking upstairs. So look, that is true, and that's the literal interpretation of a functional movement. But again, we're scientists here, and we're practicing a scientific sport. So we need to define it. Okay? And why would CrossFit have the term high-intensity functional movements if it didn't have a clear definition? It does have a very clear definition, and you won't find it on Google. Because I've looked for it. I've looked for definitions, and I think CrossFit actually has a very, very good definition of functional movements. There's a few characteristics. They're compound movements. Do you know what compound means?
Just more than one.
Multi-joint.
Yeah.
They are natural movements. Okay, so Link was demonstrating the squat before. That's a natural movement that across the world, whether you're in the Amazon jungle, northern China, Afghanistan, a little toddler who's going to pick up something will just pick it up like that. You will see that everywhere. It's programmed into our DNA. So it's a natural pre-programmed movement. When you go to Indooroopilly shopping town and you watch people in the food court bending over to pick up their, their chip that they dropped on the ground, they'll do this. That is not a functional movement. That is a movement deficiency, a maladaptation that's occurred because of all those things that Link mentioned: tight hips, tight hammies, weak extensors, weak core. So they won't do that. They will preferentially do that. And that's modern society imparting movement deficiencies on us that takes away our ability to do functional movements. So when we come here and we train, we're relearning functional movements, which is natural. We should never have lost it. We should never have lost our ability to do functional movements. And if we go to Malaysia, if we go to northern China, non-industrialised worlds, we know that they go to the toilet like this. We know that they have smoko like this. This is how they have their breaks. They maintain their functional capacity. What are the other characteristics of functional movements? They're irreducible. Irreducible. That means that if I said to a Martian who just landed on the planet, pick up this object, the most efficient way that I could teach him to pick it up would be to do a deadlift. You cannot break down the movement any simpler than that. There's no better way, or there's no more efficient way. It's the deadlift. If I said to the Martian, put something up on top of a shelf and pick it up off the ground, it would be a clean and jerk. It's an irreducible movement. The other elements of it are that they have the unique ability to express power. So, as you know, we do functional movements, and at the end of a workout, we are just gassed. We just are. Everyone is lying on the ground, just flat out. That's because that movement that we've been practicing has the unique ability to express power. And why is that important? Physiologically, that intensity stimulates what we call neuroendocrine adaptive responses. And we can measure, if I had a needle and I took a blood test off everyone after doing Fran, I could measure hormones like adrenaline, cortisol, BDNF, which is brain-derived neurotrophic factor, growth hormone, insulin-like growth factor. I could measure those hormones in your body and compare that with someone who has been in fitness first for 1 hour on a treadmill. And I can guarantee you that everyone in this gym would have substantially higher levels of those favourable adaptive hormones in their blood than someone who had been working out for an hour or an hour and a half, going for a jog or doing a try or whatever on a cycle. And why are those hormones important? They are the hormones that allow your body to change. They are the hormones that make you fitter and stronger. So that's functional movements, and a squat meets all of those criteria. It's irreducible, it's natural, it's compound, it moves through a broad range of motion. And if you do 10 squats, or a thruster, how hard is Fran? It's a functional movement. So that's why it's so important that we're good at squatting, because modern society is actually trying to stop us being good at squatting. Sitting down, as Link said, Link had to have surgery because of modern society. He can blame modern society on his requirement to have surgery. Makes sense?
Excellent. Thanks, Dave. So,